Good afternoon, friends. Today we will be going to discuss about blood analysis. First of all, I want to give you a basic idea about complete blood count. Complete blood count is important part of routine screening and hospital admission. RBC, WBC, hematocrit value, hemoglobin, erythrocyte indices, differential white blood cell count. These all includes complete blood count. We discuss our hematocrit value. What is it? It is the ratio of blood cells corpuscles to the plasma volume. Now first of all, I want to discuss about RBC. The normal level of RBC is 4 to 5 into 10 to the power 12 per liter. It is the average standard value for both male and females. Generally, in females, we know the level of RBC is less as compared to males. It is 3.9 to 4.7 into 10 to the power 12 per liter. We know that if the RBC is increased, means we can say about condition of arrhythmia, but it also increase in case of polycythemia. What is polycythemia? Polycythemia is the condition when RBC, WBC and platelets are increased. Means thrombocytes, leukocyte and erythrocytes, all three cells are increased in peripheral blood flow. So on the shape of RBC, we can differentiate between iron deficiency anemia and vitamin B12 deficiency anemia. If on blood examination, on routine blood examination, you can see the size of the erythrocyte is decreased. It will be mentioned there that pathologists find microcytosis. So we can say that is iron deficiency anemia. But if we see macrocytosis, megalocytes, then it is associated with vitamin B12 deficiency anemia. Sometimes on routine blood examination, you will see some symptoms like jolly bodies and cabot rings that also differentiate vitamin B12 deficiency anemia from iron deficiency anemia. Now next is hemoglobin. The normal hemoglobin level is 120 to 180 gram per liter. Again, I want to remember you, it is the average hemoglobin value. If the level of hemoglobin is increased, so it may be associated with the condition of polycythemia, because we know in polycythemia the amount of erythrocytes increases, so amount of hemoglobin also increases. But when the amount of hemoglobin is decreased, so we can say about the condition of anemia. Then I already told you about hematocrit value. What is hematocrit value? Hematocrit value is the ratio of blood corpuscles to the plasma volume. Its standard value is 38 to 44%, and it is increased in case of severe burns, shock, severe dehydration, and polycythemia. Then our next indication on blood examination is Clor index. The normal value of Clor index is 0.85 to 1.15. It also helps to differentiate as iron deficiency anemia from vitamin B12 deficiency anemia. If the level of Clor index is less than 0.85, that it is associated with iron deficiency anemia. But if it is more than 1.15, then we can say it is vitamin B12 deficiency anemia. Then we will discuss about thrombocytes. The thrombocytes normal level is 180 to 320 into 10 to the power 9 per liter. As we know, the normal function of platelet is the clotting of blood by the help of agglutination of platelets. If the level of the thrombocytes increase, then we can say this is the condition of thrombocytosis. But if the level of thrombocytes decrease, then we can say about thrombocytopenia, and it is in case of anemia and leukemia, while thrombocytosis in case of lymphoma, and it is mainly in malignant lymphoma. Then we have leukocytes. The normal level of leukocytes is 4 to 9 into 10 to the power 9 per liter. If the level of leukocytes increase, then it is called leukocytosis. And if it is decrease, then we can say it is leukopenia. Here we have, if it is leukopenia, then it is associated with aplastic anemia. But if it is leukocytosis, then it is leukemia. Now, the main question is to differentiate acute leukemia from chronic leukemia. How from blood examination you will find it is acute leukemia or chronic leukemia. We know in acute leukemia we can see leukemic hiatus, means there is absence of intermediate cells. So means there will be no metamyelocytes, there will be no promyelocytes, and there will be no myelocytes. So if on blood examination you see these cells, means it is chronic leukemia, and if these cells are absent, then we can say about acute leukemia. Then we also have some cells like eosinophils that normal value is 0.5 to 0.5%. Their level is increased in case of allergic response, and basophils from 0 to 1%. And we know that neutrophils is divided into two parts, step and segmented. Step normal level is 1 to 6% and segmented 47 to 72%. We know when neutrophils is increased in case of bacterial infection, in case of diabetic acidosis, and in case of infarction. Then lymphocytes, the normal level of lymphocytes is 19 to 37%, and we have, if the level of lymphocyte is increased, that condition is called lymphocytosis. It is the acute disease, and it may be associated with thyrotoxicosis. But if the level of the lymphocyte is decreased, then we can say about condition of Hodgkin lymphoma. We can say about condition of lupus erythematosus, and we all know from path anatomy that lupus erythematosus means systematic lupus erythematosus is autoimmune disorder. The next is monocyte, that is 3 to 11%, and if monocytosis happens, means the level of monocyte is increased. We all know that the level of monocyte is increased in response to infection, but the main role is in scarlet fever. And at last we have erythrocyte sedimentation rate. Its normal value is 2 to 15 mm per H. I want to make your attention that it is again average standard value for both male and females, and it is associated with inflammatory process and anemia, and is also associated with some disease such as malignant tumor, leukosa, rheumatic fever, tuberculosis, and arthritis. I want to make your attention that we discuss about the decreased level of erythrocytes, thrombocytes, and leukocytes. But I want to pay your attention if all these cells decrease at the same time, that condition is called pancytopenia, and that is associated with a syndrome that is called syndrome of hypersplenism. Let's have a sample of an analysis. As we can see, the level of hemoglobin is 88, means it is reduced. The level of erythrocytes is also reduced. And we can see here special cells, reticulocyte cells. What is the function of reticulocyte cells on blood examination? The normal level is 0.2 to 1%. Sometimes we can see on blood examination that these special reticulocyte cells are absent. So that is the condition for hypoplastic and aplastic anemia. And the level of blood index is reduced, then it is also anemia, hypochromic anemia. So what we see up to here we conclude that it is iron deficiency anemia, because I already told you hyperchromic anemia is the condition for iron deficiency anemia. But we must check complete blood analysis. Maybe some other cells also reduced and maybe increased. As we can see, thrombocytes decreased, leukocyte decreased. As we can see, the level of erythrocyte, thrombocytes, and leukocyte is decreased. This condition is called pancytopenia, and pancytopenia is associated with the condition of hypersplenism. So this condition is hypersplenism associated with iron deficiency anemia. Then on second analysis, we also see the amount of hemoglobin is also reduced, erythrocyte level is also reduced, the color index is also reduced, but here we can see the level of thrombocytes and leukocyte is normal. So we can say this is iron deficiency anemia. How we conclude it is iron deficiency anemia? From color index, because we also have another deficiency, that is vitamin B12 deficiency. But vitamin B12 deficiency is when the level of color index is more than 1.15. Thank you.